so making an occupied bed. So when you get this skill, you're gonna have to come over to the linen cart and get all of your supplies, okay? I recommend, like we did last year, putting them in the order that you're gonna use it. So you need a pillowcase, you need the comforter, drop stuff. You need a flat sheet, you need the fitted sheet that goes on the mattress, and then you need a bath blanket for your patient, okay? Right? I don't care, you can get it in any order that you want, but it makes sense to get it in the order that you're gonna need it. You need to carry it away from your body, right? So it's not up against you. You're gonna knock on your door.
Don't you need the cart?
Yeah, you'll have the linen cart, but it's gonna be just in the center of the room during your state test, so you'll remember it.
Come on now.
So linen cart there. You knock on the door and you come into your patient's room. You can put your linen on the bedside table or the table next to him. Just don't put it on the dirty bed, right? I'm gonna wash my hands. I'm gonna pull my curtain for privacy, introduce myself, explain what I'm gonna do. I'm gonna bring the bed up to my waist level, but before I can do that, I need to lock it, which is a critical element, and I need to bring my side rails up, which is a critical element. Then we're gonna bring our patient up to our level, comfortable.
And then
Hip waist, or waist level, hips, either way. It's all the same words, right? Your patient needs to be flat. I know you want to sit up. You have gloves on because you're gonna be touching a dirty bed. Another thing, you can work over this side rail or you don't have to work over the side rail. Best to not work over a side rail, but you can do it either way. So you're gonna start by putting your bath blanket on your patient without flinging it, right? Because we don't wanna spread any more microorganisms. So we're gonna cover her.
So when we do the state test, we do it with a dummy or whatever.
Nope, there'll be a real actor in the bed for the state test. Okay, so we have our bath blanket on her.
she better be skinny. Please, and I ain't lifting nobody that's heavy.
You will if you have to.
I don't look at
So you're gonna roll away. I'm gonna move this so you guys can see. I'm just rolling these down from her so that she's still covered, but then I can roll them away. Because dirty linen always gets rolled away from you. And since I'm moving kind of far away from my patient, I'm gonna put my rails back up. And those are the critical elements that when you walk away from the side of a bed, your side rail goes back up. Okay, we put this in our dirty linen.
Are we supposed to say all this stuff?
No,
Or just be quiet while we're doing it?
you can be quiet while you're doing it, but I suggest just telling her everything that you're doing because some of it is verbalizing that you're checking for this, that, and the other. That way she knows you're doing everything you're supposed to be doing, okay? So, now I'm back on this side. Now we're gonna roll our patient over, same way we always do, arm over, and then her feet over her feet, right? And then we're gonna turn her on her side while keeping her covered with the bath blanket. Now we're gonna take off the fitted sheet and roll it up underneath her. This is a long skill, I know, but it's not hard, I promise. And then we're gonna take our fitted sheet, right, the one that's elastic, fits on the bed. We're gonna unfold it without flinging it and throwing it all over the place. You're gonna start it on this side of the bed.
Doesn't matter.
Doesn't matter which way you start, just as long as you do these two sides while you're on this side. And then I kind of stretch it out and roll it. So that way I know it's on this mattress good. And I roll it underneath the old blankets. Now I have my patient come back towards me. She can lay on her back. And I'm gonna put my side rail up. I've come to the other side of the bed. I'm gonna put my side rail down. I'm gonna roll her on this side of the bed, onto her side. And while she's up, I'm gonna remove the old blanket. old blanket away from my skin or away from my uniform. When I walked away, the side rail went up. Now I'm gonna pull out this fitted sheet and put it on the mattress.
She needs some
Lay on your back.
They my fault she dropped the donuts and not a big deal.
You put your patient back on her back. Now we're gonna put on our flat sheets. And you're gonna do it so that way you're not flinging it again across your patient.
So will the person we do like be older?
She's about my age.
That's what she
Can you be my patient then? They bring a person.
So I put the flat sheets up to about their neck, okay? And I try and make it even on both sides of the bed before I get too far into the skill. I bring the length of it over top of the foot of the bed, okay? And I come back up here and I remove this bath blanket. This is what a lot of people forget. They forget the bath blanket's on, and then you leave it on.
That's
So
the point.
It is a point to not remove it, yeah.
This is 1 point.
Just 1 point. So I take it off and I put it in the hamper.
And we allowed to miss what 8?
This is a longer skill, so you can miss more points on it, as long as it's not a critical point. It just depends on how many you really miss, if you pass it or fail it. If you missed 10 out of 20, you've missed half the steps, so you failed. If you missed 3 out of 20, you probably passed, right? Probably.
If it ain't a critical.
Not critical. So same thing with this. I'm gonna put it over my patient. I bring extra so that way she's got some for her head up here. I bring it over the foot of the bed. Fix it on both sides, okay? And then we take the foot of it and you tuck it underneath that mattress. Remember as juniors we did that? Your state test book says to make sure that you take the toes of your patient and pull up so that you don't give them a pressure ulcer, right, on the top of their feet. Try and make her blankets look nice up here so she's comfy. Now you're going to do your mitered corners. Do you guys remember this last year? This is the thing you guys hate. So, it is a point, just 1 point though. So I make the triangle or the sailboat, right, the sailboat top, and then I lift up under the mattress and put the rest in.
At times they do not look like that.
They do not look like that, but that's how they're making them, I promise. Okay, I can see my blanket's a little crooked down here, but do the same thing, the triangle or the sailboat, and push it all up underneath. Make it look nice. Put my patient down. You'll put your side rails back down. You'll give her her call lights. I make her comfy. Before I forget, your pillow you need to fix. So you have her lift her head, take your pillow off, okay? Put it in the hamper.
You ain't never found no bugs in them before?
No, I have not. That's kind of gross. So I take the pillowcase and I kind of turn it inside out, like on the inside, so that I can grab it and put it on my pillowcase. Because you kind of do it with